Hi guys, is it possible for the Conservatives to be honest for 5 minutes? No, I don't think so. It's practically impossible for them to do that. So Mislead, the Shadow Chancellor, was on the Laura Kuenssberg show on Sunday, where he and his party are pushing a policy of removing benefits for foreigners, sickness benefits for foreigners in the UK. Now, there's a massive problem with that, which I'll explain in a moment. But first, let's have a listen.
Today, that it wants to stop foreigners getting access to some sickness benefits. How many foreign nationals get those benefits right now?
So what we know is that the cost, for example, of benefits into households where there is at least one foreign national living in that household is about £1 billion
But that's households,
per
that's
month.
a different thing.
About £1 billion per month. So what the actual amendment that we're coming forward to the
He didn't answer the question. The question was how many foreigners are accessing these benefits. Now, it's important to remember that in order to access these sickness benefits, you need to be paying national insurance contributions. So you have to be working. So we're talking about foreigners who are working and then claiming a benefit, which they should be entitled to because they're working. But the framing that the Conservatives have is it's foreigners coming in as asylum seekers or immigrants or whatever, not working and claiming sickness benefit. That's not the case. They can't do that. And you notice here he mentioned households with a foreigner in the house, not actual foreigners claiming the benefit. So he's trying to fiddle the figures, which is extremely dishonest. But of course, we're talking about Mislead here.
welfare bill with is asking the government to do is to come forward with a discussion paper to look at this issue as to the benefits that are received by people who are British nationals and those who are foreign nationals living in our country.
But and you don't know, as things stand, how many people this would actually affect.
Well, as I say, what we know is that it's doubled over the last 3 years, and we know that the costs actually at a household level is about £1 billion per month. So about...
Once again, about households, not individuals. So you could have a situation where there's a household where the person who's a foreigner is actually not making a claim, but somebody else in the household who is a British citizen is making a claim, but Mislead and the Tories want to punish everyone because of that.
£12 billion per year, and what we're actually saying, just to be clear, Laura, is we're not coming forward with absolute nailed-down policy in this area. We just think that it's very important that this is an area that's properly looked at, and so our amendment is calling on the government to come forward with a discussion document.
So this isn't actually a settled plan, you're just saying to the government, please, we think we should have a look at this?
We think that it's really important that we do that. We think that it's also equally really important that when it comes to those higher level health-related benefits, where often mild anxiety or mild depression and so on are proving to be a route onto those benefits, that we should have a good, thorough look at that.
And you think
exactly
that's happening often, to use your word, often?
Yes. Well, when we were in power, actually, we brought in reforms to the work capability assessment that saved £5 billion and saw 450,000 fewer people, according to the OBR, not us, according to the Office of Budget Responsibility, going on to those long-term sickness and disability benefits.
What the Tories are doing when they talk about, well, our success in government is that they kicked a lot of people off benefits. And then they point to the OBR as, look at the data from the OBR. They did not consult with charities. They did not consult with organizations that represent the disabled. They just said, let's kick a lot of people off so we can bring down the number, bring down the figure. And look, the OBR backs up that figure. We cut a lot of benefits and we saved this amount of money. And no consideration for the people actually involved here.
That's
because we believe, Laura, we believe
often people with mild symptoms are going on to benefits.
We believe that, particularly when it comes to mental health, one of the best solutions to those kind of challenges is work. We are the party that believes in work, and we don't believe that welfare should trap people. We believe that welfare should be there for those that are vulnerable and need it, absolutely, and some people cannot work and should be looked after. There's an argument that says they should be looked after even more than they are now, but we do need to be encouraging and having a system that sees people going into work, not staying on benefits.
The entire Tory approach to this is, we don't believe that you're ill. We don't believe that you're physically ill, and we don't believe that you're mentally ill. We have decided not to invest the resources necessary to check or to make sure that if you are, that you get the support you need. So what we're going to do is we're going to push people off benefits, and we're going to look at the actual number, the cost of this, and the saving as they will describe it. These people should be nowhere near the levers of power. You think but things are bad with the Labour government. Completely terrible under the Conservatives. What they want to do is they want to kick people off benefits and to hell with the consequences, because their goal is just to bring down the number. Bring down the number of people on benefits and the cost. They are responsible for the deaths of 300,000 people as a result of austerity. They want to do it again. They want to get back into power to do it even more. And they should be nowhere near that. They should be nowhere near the levers of power. They should be nowhere near number 10. They were responsible for so much carnage, and they have not apologized. They have not admitted it was a mistake. They want to get back in and do it again. Let me know in the comment section, guys, what you think, and I'll see you in the next video.